that one. Hi, good morning from the hill country of Austin, Texas. And I'm here with a guest that I don't even know where to start, how to introduce. We were just chatting it up. I mean, we have such a great story. She's one of my first students when I had professorship at Montco in Pennsylvania. And Tiff was in the front row every time she came in the class early so she could get front row seat right in front of me. And she went on to Widener and sexuality, and oh my goodness, the list goes on. And I said, well, I'm just going to let you talk about what you have accomplished and who your patients are, your clients, that's a better word. And I really feel like I still have a hand in what Tif is doing, because we started social programs for developmentally disabled folks back then, and they were with me, and they're still doing it, and their partner is doing it too. So it's like, well, there's still a piece of me floating around in Pennsylvania, and with a population that is near and dear to my heart. That we have our ID folks having social services and maybe even getting out there and dating and having, you know, I don't want to say normal life, because again, I wrote a book about what's normal and no one knows anyway. So, but what's naturally wired into us, no matter what our IQ is, you know, when we're babies, that's our most developed sense is touch. We need touch. We need to feel the warmth and the closeness of another human being. And it's from birth till death. That never changes. And it doesn't matter what your IQ is.
Right.
So, well, I'll just let you take it from here. I could go on and on about our journey, but I want them to hear about your journey where you picked up, because I was at your graduation too.
Yes.
So you took it from there.
Yes. So absolutely. I mean, you have been from start to continued. I don't even want to say end because there's no end, right? But from start. And so sitting in your class was my awakening, right? That was where, after years of trying to figure out what am I going to do with my life, sitting in that class was like, this is it. The light bulb went off. Here it is, right? And then that's where that attachment, and you brought in awesome people, right? Like Dr. Michelle Angelo, Dr. Bill Staten, Dr. Marla Coben, and created this family. And then that trajectory moved on to my time at Widener. And while I was at Widener, finishing up both undergrad and then moving on to the master's program, my world started revolving around trauma, right? And what are the populations that experience trauma the most, right? People of color, individuals with disabilities, right? Neurodivergence, and then the LGBTQIA plus community. And that's where my academic world just started shaping, right? How does this big thing like trauma affect these populations? And what can I do with that, right? As a social worker, how can I help that? How can I heal that? So yeah, that's where the academic trajectory then went. And so then getting to the PhD part, it's like, well, I can't write a dissertation without acknowledging trauma, since that's been such a big thing. So the focus of my study was on individuals, on therapists and how they incorporate sexuality into their work with specifically young sexual abuse survivors. So the ages of 5 to 16. How do you as a therapist help heal that, right? How do you help heal those things? Like, how does a sexual abuse survivor now interpret touch, right? In safe touch and healthy touch, in a therapeutic setting, right? You know, how do you heal all of that? And so it was just a very smooth transition, even though in the moment you feel like, oh my gosh, this is such a big decision. What do I do with life? But it was all right there. And it all started in that class, in that front row, you know, back at Montco. And it was just a beautiful journey to being in a place where I am today. And every step of the way, there has been a caring of you and just this breath of fresh air of everything that we do. And it comes with struggle. I don't want to paint this picture that it was an easy experience, but our folks with disabilities, for example, you know, they are such a marginalized population in ways similarly to elderly population, right? Where it's this concept that they can't be sexual, that they can't be touched, that they can't be supported. And there are so many barriers to getting supports, for
Yeah,
those
'cause that
folks.
can't is also they shouldn't be touched.
Right,
That, yeah. So
right.
that all the fear around people's own stories there that the caregivers bring in their own fear stories, and then it gets landed on, well, these people are developmentally disabled, so that they don't really want relationships, and so we don't, it's just been a struggle to have the wake up here. Yeah, so you're carrying the torch from. I think when I left Philadelphia, when I was working for the county of Philadelphia, and then you took over that program, right?
Yep,
That's what
your program.
You and
Yep,
Dan did the social program. We had
yeah,
date night for couples, right? Dinner and a movie
yes,
night for
yes.
couples.
Yes, yes. And it was just phenomenal. I mean, that program itself so it was set up to be then a 10-week program by the time I took it over. It was a 10-week program, and they would come once a week, and we'd go to either their day program or wherever. And we would have these conversations about healthy relationships and consent and appropriate touch. And I had so many folks say to me, I'm allowed to date? Like they never even thought that it was a possibility. Or, I had folks who were getting in trouble because they were inappropriately touching people, right? And they didn't know that that wasn't okay. So there's this dynamic that I can't wrap my head around. There's this lack of touch that we just talked about, right? Like they don't need that. They don't want that, things like that. And then on the flip, they experience sexual abuse at higher rates than any other population, right? So it's almost like the touch they're allowed is bad touch, right? Or harmful touch, I should
Right.
say. And that comparison or that concept is just, it blows my mind that that's where we see it, right? So for example, I've had folks where I've trained and they identified as more neurotypical. I don't know their diagnoses, but these were folks who didn't have a disability. And they say, yes, but that little person with Down syndrome, they might not get a hug. And I just feel like I need to hug them. And it's like, well, let's pause there, because one, you're completely dismissing that person's family and the love that they give that person,
Yeah.
right? And you're creating this dynamic that you as a stranger are the only person that can provide a loving type of interaction, a physical interaction, right? So that just that mindset is unhealthy to begin with. And changing the mindset of, it doesn't matter how old this individual is, whether they process like you or not, they deserve boundaries and consent just as much as anybody else.
Yes.
So that program like blew up. I mean, pre-COVID, we were doing easily in a semester, from like January to June, 50 plus groups, right? So
Yeah, right.
yes, and they went down as low as kindergarten. We did these for kindergarten kids, and the kindergarten kids are at like 18 to 24-month cognitive level, and they were still able to grasp these concepts of boundaries and consent and healthy touch and all of those things. It was just phenomenal. And
Oh,
yeah,
gosh,
it was
this is
great.
a book. This is a movie.
Right?
It's a movie, Tiff.
Right? With
Wow.
finally a happy ending.
Yeah, yeah. Oh,
Yeah.
so good. So
Yeah.
terrific.
It is. It is.
And then you have your other practice with EMDR, right? Where you focus on the rest of the population or anyone walking in a body.
Yeah. Yes, basically.
Yeah.
Yeah.
Tiff and I were talking about, well, where are the letters now? LGBTQIAA, and yeah, and as everyone's heard me say, and they know by now, I've written a book about, am I normal if, like, what is normal? Who gets to say and who gets to dictate, the normal of your life, let alone the normal of your fashion, right?
Right.
Go from what you wear to who you love and say, well, this is normal and this is the box. And then
Yep.
you talk to somebody else, well, their box is, then there's another box. And then the year after that, there's a new fad, there's a new hairstyle, and there's a new box. So it's like,
And in the meantime, you as a human being are continuing to evolve, right? So this box may have fit last year, but now a
yeah.
year later, you're a totally different person, right?
Right.
And I look at that specifically to the LGBTQIA plus community in the sense that we would have so much less distress and mental health issues for that population if we would just allow our children, our teens, our adolescents, just people to develop as they go, right? Like you don't have to feel the pressure of, I have to come out, I have to pick a box, I have to say this, to honor who I am, versus just being you, right? Who are you today? Who are you right now in this
Yeah, why
moment?
does it, and I know Dr. Michelle Angelo, who we both work with and love, was the first one to write a book
Yeah.
about the 4-year-olds. And we had 4-year-olds in our office. And
Yes.
that was totally against what was being taught back then, like 20 years ago. That, oh no, you have to guide kids to be in their correct gender and correct gender.
Right.
And so I feel we were really instrumental too in getting that
Yes.
conversation out, because she took a stand
Yep.
against the Mooney, wasn't it
Yep.
Dr. Mooney's mandate that, you don't touch this, you until after they're fully developed. And
Right.
I think we've saved lives, Tiff, because is it
Absolutely.
still that teen suicide is wrapped, the percentage is wrapped up in this conversation?
100%. Yeah. I mean, the higher rates of suicide, and unfortunately, with the anti-LGBTQ legislation right now, unfortunately, we're anticipating higher rates of suicide. And this concept of gender affirming care, as a therapist, I'm not a surgeon, right? So if a kid or a client comes to me, for gender affirming care, what that looks like is honoring who they are as a person, using the name that they come with, using the pronouns that they come with, right? Encouraging, hey, they wore a bow tie today and you look fabulous, right? That's gender affirming care. Gender affirming care is seeing the individual for who they are,
Yeah.
not who the people who feel that they have power say they are.
Mm-hmm. The
Right.
shoulds. The
Yes.
shoulds get us in so much trouble in
Yeah.
so many ways
Yeah.
that, I'm just so grateful that I'm still here and in this position to see the advances that we made since the 80s. And
Yes.
then the 90s, when just gay people were struggling, with their the orientation. I don't know if you were in the room, but at Monco, there was that conversation was going on about, are people gay because the fathers are missing fathers, or missing, or because they just want attention, or they just, and I just spoke at a church up in Doylestown, and Susan Manning, Reverend Susan Manning, was
Oh,
Susan
yes.
here?
Yes.
So she was in that class when I first went up, and because we had this whole conversation going on about orientation, and I walked up to the board and I drew a circle and I put it into like a peace sign.
Mm-hmm.
And one side was this is your nature, because it was all about, is it nature nurture, right? Are
Right.
they born this way, or are they made this way?
Right.
So what if it's, your nature's over here, nurture's over here, and down here in my third theory, which I have trademarked, is just plain damn you,
Yes.
right?
Yes.
So
That's it.
plain damn you was born. I think you were probably in that class.
That sounds so familiar. So either I was or we had talked about it, because yes, I
Well,
know
we
that.
definitely
Yes.
talked about it, because I've written a book about it, and I've got the symbol. It's our symbol. It's like, this is who I am.
Right. Well,
And
and the concept is that nature informs nurture and vice versa. However, you see cases all the time, myself being one of them. I grew up in a family where I had a mom, a dad, a brother, like the stereotypical family, raised Catholic. I don't remember ever seeing a gay, a trans, a queer, a person, none of that in my life. And
yeah,
here I am now, a full grown adult who identifies as a trans, queer, non-binary human. Like, where did that come from
and
then? Right.
probably knew you were different. Like, what were your
100%.
early messages? Like, how did your journey unfold?
Yeah, so the messages were very, what I would assume, stereotypical to America, right? Like, you were born with a body that people say is a female. So what that means is you are going to get married to a man, and you're going to have children, and you're going to do all these things, or you're going to get married in the church. And I remember being 7 years old in a casino with my parents, and there was this piano player. While one parent went into the casino, I stayed with the other, and I'd always go to the piano player because I loved music. But I realized it wasn't just the music I was looking for, right? So there's this piano player who was, gosh, at that time felt like 7 foot tall, wore beautiful gowns with a slit up to their hip. And I just remember being infatuated with this human being, going, I love this person, right? What is it about this person?
Yeah.
But at 7 years old, they didn't have language for that. They didn't teach language for that. So it was just like, I know what this is. And then once that was gone, was like, all right, I guess that's done. But at 7 years old, I wasn't like, I'm going to marry a woman or I'm going to marry this person. It was just,
Yeah,
there's something I am attracted to by this person.
right.
And again, life just continued on until college, when I was like, hey, I think this might be this thing called gay. It might be a thing, but I mean, I remember being teased about it in high school, but I'm like, what does that mean? I'm not gay. Like, I date boys. I'm not, what is this gay? Like, I didn't even have the education to know what gay meant.
Yeah,
Right. So then by college, it's like, oh, that's what it is. I think it fits. And unfortunately, I was physically assaulted as a result of coming out, right, in an attempt to protect people who were out. And the journey just continued. And even to this day, the journey still continues, right? You know, do the names fit? Do the pronouns fit? Who am I? Just be damn you. And it's not until being an adult where I feel like I have some
right.
control and safety in life. I can be me, but all that is met with, am I safe? Is my family safe? Right? It still comes back to that in our country. In a country that's supposed to be thriving and successful, it comes back to that. And then the fear sets in with all of these anti-legislations that are going on of, are we really safe? What does the world look like in the future for us? Right? You know, those days where we couldn't get married, those days where we couldn't say partner, is just roommate, right? You know, whatever it may be.
Yeah,
And it feels like the pendulum just kind of keeps going back and forth, and it's
yeah.
exhausting.
But I'm encouraged with this shakeup because we have been through so much now, and people have more of a voice
Yes.
that are outside the box, you know. And you know, I'm living it here in Texas, where
Yep.
they're going after the parents,
Yep.
and where they're making legislation. And someone asked me on an interview, actually, that when I was at that college, one of the students asked me, "Do you think this is what's happening with all these legislations?" And it's like there's this big push now to make attack on everything to the autonomy of our bodies.
Right.
You know, they brought back the abortion legislations again, and there's no clinics here in Texas. And you know, the rights to our bodies, who we want to be, what. And my sense is that there's so many fronts that are shaking up the world,
Mhm.
and the old paradigms, the sick care that we have with the drug pushers.
Yep.
You know, the people are waking up to natural remedies. And I think COVID helped to do that.
100%.
Right? So we had to go through that hard time. And I think what we're going through with people's autonomy to their bodies is the same thing. It's a shakeup. It's like
Yeah.
you know, it's such a big conversation now inside of people saying, this is who I am.
Right.
Right? We're not hiding out anymore.
No. And
Yeah.
the concept of, oh, it's new, it's a fad, it's a thing. No, it's always been there. It's just people have found
Yeah.
a place of safety to now do that shakeup.
Right.
And if I look at, so if you, the populations that I serve as a clinician and an educator, you know, disabilities, trauma, LGBTQIA, we talk about those populations as marginalized, and they are marginalized because our system was created to marginalize those folks.
Yeah.
But break that down a little bit more. Every human being that is born has different abilities, right? Some have the abilities that our society has created as the norm or typical, right? And some don't. But
Right.
as we age, no matter where we are in that aging, we all come across some type of different ability in our lifetime, right? Whether it's the loss of hearing as, you know, an older person, whether it's an accident as a younger person that, you know, affects the physical body, right? So, okay, we all have different abilities throughout our lifespan. So are we that marginalized there? Second, even the folks that are creating these legislations have a gender identity, have a sexual orientation, have a gender expression, right? And then even more so, it is so hard to find any folk in this world who hasn't experienced a trauma, right? So look at all those populations that we marginalize and we silence, but yet you're not seeing the bigger picture that that's just human experience, varying levels, right? You know, so for example, someone of color who fits any of these categories experience marginalization at a completely increased rate, unfortunately, right? So to be a Black trans disabled person, oh my gosh, I just want to be able to change every legislation I can for you, right? But we just miss that part. We paint these pictures that these folks are over here in the corner, and nothing can touch that, right? But yet you're standing there as a representative, as a politician, as a person who actually fits all of those things as well.
Yeah.
Just mind-boggling.
eh, well, that it's out now, that
Mhm.
there's dialogue, that there's more uh, people that are in the other categories, especially are people of color who
Yeah.
are banding together. And I think we're all in this boat together, even as a woman, I feel.
Yes.
You're not, Bill Staten told me this 30 years ago. If you're not white, heterosexual, able-bodied male, you have to fight for rights.
Yes.
And that's becoming very clear now.
Yes.
And so that's why I'm encouraged. And I hope I still get to see it in my lifetime, because I've worked for it my entire life. You know, it's just been this journey I've been on, and I know I'm leaving seeds behind. Like,
100%. Yes.
yes, but it is exciting because, you know, you wait and wait and wait for things to happen. Like, oh, I want to get my degree, or I want to get the house, or I want to get. You wait and wait. Finally, like everything happens at once. Oh, I got the house. Like, I got my degree, I got my job, I got, and I was next. Like, it all happens at once. And I think that's what's happening now. Like, we have fought for every one of these pieces that we're talking about of society since the 60s. And
Right.
I am in that generation. I can't march anymore. My feet are wore out, you know, but you know, we started back then.
Yeah.
And, you know, we hit bumps because in the 70s, they said, hey, we got to stop this. We got to
Okay.
stop this movement. We can't have, you know, people of color getting degrees. We can't have
Right.
people that are call themselves other, you know, genders, or we have to stop it. I just read another article on it. And that's what that when the hammer came down, they put into motion, but we're back.
We're back. Right. Yes. And
Us
it's
old
about,
hippies are still hanging in, and now you young folks, I don't know. It's there is another term. What's the term for your generation? Or
I see, I always get confused. The millennial generation, I don't know where I
oh,
fall.
oh, okay.
I don't know. I have to keep looking that up because I'm like, wait, am I a millennial? I don't know.
Yeah. Well, like we were talking, Hannah's 29. I think she identifies as millennial.
See, I think I'm on the cusp because I was born 85.
Oh,
So
okay.
I think I'm on the cusp
Yeah.
of, I think is it Gen Z?
Generation X, is it?
Something like
Or
that.
is
I
X?
don't I don't keep
Anyway,
up. I
but you know, it's the box. We got to put you in the box. Come
right.
on.
What age box am I? Right, exactly. Yes, yes, yeah.
So I want you to make sure, I want us to make sure we've listed everything and that folks heard that you work with trauma and
Yeah.
you work remote. And do you have an office space where people come, or is it all remote?
So right now, so the company I created was Maverick Therapeutic Services, and the name came out of Maverick, right? So somebody who
Yeah.
doesn't go with social norms, somebody who makes change and waves and things like
Yeah.
that. And it's also the way I spell it. It's Maverique, and that is actually a meaning of non-binary, right? So it has all
Ah,
these very big meanings to me. So Maverick Therapeutic Services. So the clinical services, I serve both Pennsylvania and New Jersey clinically. I try to focus between the ages of 12 and 45 and the populations of LGBTQIA plus, disabilities, people of color, and survivors of trauma. That service is all virtual right now. Hopefully one day a beautiful office will be in the future, but for right now, those are all virtual services. And I am EMDR certified. It is a practice that I absolutely love. So eye movement desensitization and reprocessing. I have found it is just so impactful in healing trauma. And one of the greatest gifts I get as a clinician is seeing clients go from a victim stance to a thriving stance. They just pass right over survivor and go right to thriving. And I think EMDR plays such a huge role in that, and it's just phenomenal. So that's part of the work, is providing that trauma support. For other folks, it's they're looking at their gender identity, their sexual orientation. They're just like, I need someone to help me explore this, right? What does this look like? What are my options? How can I just be damn me, right? How do I get to that point? And you know, so it varies. Clinical work really varies. So it's within those populations and whatever they need. The other part of it is training and education. So the training I do, I can do virtually, but I also, depending on where it is, can go in person. Those trainings revolve around my specialties, right? How can you make an inclusive workspace? How can you help with your paperwork, right? Like, are your documents inclusive, right? Does your workspace also offer accessibility to all folks, right? Whether it's physical ability, hearing, whatever it may be, is it accessible to all humans? So I do a lot of trainings around that. I do training specifically around trauma and LGBTQIA+. One of my favorite trainings I've done is with myself and a wonderful, wonderful human being, Joyce, who we used to do, we called it, we were on the road doing trainings. And we actually trained the sexual assault nurse examiners. And they are a phenomenal group. So these are the nurses that do the examinations after somebody has experienced a sexual assault. Yeah. And we help them learn how to carefully and efficiently and respectfully work with trans bodies while doing that, and what they can have in their kit to support that person leaving the office. So for an example, sometimes folks come in and their wig was ripped off during the assault, right? Or their clothes were ripped or something like that. So talking about, do you have something that they can wear where they still feel like their self, right? Like themselves when they leave after this very invasive, unfortunately, examination. And that training will always be, I did a couple of them, and they will always be the closest to my heart. That was just a phenomenal experience to be able to provide that support and education ancillary to the community, but to these phenomenal humans who are doing amazing work. So yeah, trainings can be in person and virtual. I also do psychoeducation groups for schools. So right now I'm actually in a school district. We plan for a 6-week group for all the LGBTQ kids, and they come once a week. And oh my gosh, Dr. K, when I tell you the first week they opened the doors, over 60 kids walked in, and I just lost it. I was just like, this is beautiful. It's in a county where LGBTQ is very much ignored. And just to see these littles come in and ready to learn and ready to figure out who they are and what they need in life, it was beautiful. And actually today is our last group, so it's bittersweet, but that was a phenomenal experience. And this educators and social workers who are at those school districts are just a phenomenal support. So I love doing those. I love running groups. I think they're so much fun. And then, I offer the supervision for folks who are continuing their education for an LCSW. So folks who are looking to work with these populations that I currently work, they can seek me out for that support for their licensure. So it's sort of a catch-all company as much as it can be.
But you got it covered.
Yeah, well, I try. So yeah, so right now it's a one human show, but hopefully in the future, maybe I'll be able to get some more humans who can really take on the mission. Maverick Therapeutic Services has a wonderful, phenomenal board of directors. They are just absolutely amazing. And they're really helping bring this dream to life. And what's amazing about it is there's so many hurdles when it comes to clinical work, right? Of who you can serve, what you can do. And I think that's the beauty of Maverick is whatever you need, we're here for, right? We'll make it work.
I hear that. I'm just like, how much energy does it take to do your day? I mean, and you're still energized. You're like, I can see it. Like you're just running on adrenaline of joy of what you've been able to accomplish, and what yet still you're going to be able to make a contribution in such a huge way by meeting with the children. As young as we can get them to say, hey, you're okay.
Right.
And I all want to hear, you're okay.
Yeah, that's it. And I wish, like you said it beautifully, the joy, like all the people who are not supportive of folks with disabilities and LGBTQ and survivors of trauma, like sit in a car with me on my drive home after that group, blaring my show tunes, my Broadway show tunes, and the joy and the just the honor that is exuding from my body at that point. I wish they can see what this kind of work can do. And that's what's energizing, right? To be able to see that little human's face, or that 55-year-old person who finally learned that they can date.
Yes.
Right. That they don't have to miss that in their life because they were never told that was a part of their life experience. Right. And there's just so much joy and honor in that. That's what energizes, right? That's the batteries that I'm given that keeps me going day to day.
It's the you with you that you got in touch with sitting in that front row seat.
Yes.
And that's one of the chapters in my book, because that's what we look for in people when they come in and they're like, excuse me, going on about, I'm not this, I'm not that. I'm like, let's find out what's you with you. you know, what's normal or what's your natural. I'm sorry.
No.
I'm having a fit here. Yeah.
Well, and that's the beauty of it, right? And as humans, we are constantly evolving that you for you, and it's informed by life experiences, by the things you see, that you're taught, that you're not taught, then taught, right? There's so much that influences that you.
Yeah. So that I'm gonna have to cut this part out.
Take your time.
I inhaled, and I think I inhaled some.
Yep.
All right, I mean,
Yeah, take your time.
I got too excited.
Well, you said Jerry's good with that, so I'm sure he could be like splice.
Yeah, he'll splice it out. So let's pick up on so in the work that I do with that plain damn you wheel is, let's find out who you with you is.
Yes.
And that's your normal or your natural.
Right.
Natural for you. And so having you experience what you're experiencing because you're totally in alignment with your you with you. And that's where the deep joy is. And when we take that away from other people and say, well, you can't do this, or can't do this, can't do that, or you have to be this, have to be that, it squashes what we came in to, our gift to humanity. And I feel like, as I was listening to you, that we are, our whole sense of humanity and how we are with each other is in trouble.
Yes.
Like, we've lost our humanity with each other.
Yes.
Right. And so it's getting that back. And that comes with people bringing their gifts, their plain damn you, the you with you, and then sharing that you with others. And you're totally, you're getting children that they don't have to suffer through till they can get out on their own, or have finances to support this piece that niggles in them and won't let them live life.
Right.
As you say, at 55, they're still not had relationships. And so
which, what a beautiful piece of life that they're missing. And they're missing it not because they chose to miss it, they're missing it because they weren't given the opportunity.
Right. Yeah,
absolutely.
Well, this has been incredibly wonderful on so many levels, and that you're out there with this huge conversation, and literally we can say that you are saving lives.
I appreciate that.
Whether it's that they would take themselves out, but just that they walk with life in such distraught and disconnect that they're not alive in the way that life is meant to be lived, to be contributing and a part of, and the joy of being in a body. We were designed for pleasure, number one, and we were designed for joy. And when that's taken from us, it affects everything that we are, body, mind, spirit. So
the you, we got to go back to that you. Where's the you?
The you with you.
Well, it has been a true pleasure.
So we have people know how to get you now.
Yes. So you can look up Maverick Therapeutic Services. We have a website. A lot of our stuff is virtual. We also have a Facebook page. So all the contact information is on there for clinical support if you need some therapy work, for training, or for licensure, or for some psychoed groups at schools. It's all there.
Thank you, Tiffany, for being you with you, for trusting me, for taking me home to your parents, who we had to convince you were
human sexuality is a thing.
Human sexuality is really a discipline.
Yes. Well, and thank you for igniting the you in me all those years ago, and creating this life that I would never have had if I didn't have that moment sitting in that front row.
Yeah. Well, thanks for trusting me too.
100%.
All right. Well, go be great, and we'll be in communication. I'm already got some clients I'm thinking about to send to you. So we have to do more collaboration like we used to do. Now that you're settled in with what you're doing, I know now more of what the clients are that are looking at that could be patients or clients for you.
Yeah, I appreciate that so much. Yeah. And please, reach out to Autumn and see if she can help with that one case.
I will.
Yeah.
I will. Okay, so I'll say goodbye
Okay.
for now, but stay on. So I want to talk to you, but
Oh, yes, yes.
bye to our cyber folks. Thanks for being with us. And you know how to get a hold of me, I'm sure. And now you know how to get a hold of Tiff. And again, thank you for who you are, what you do, and what you have landed on the planet.
Thank you.
Okay, let me get